surgery procedures lesson. Okay, let's move to today's surgery. Patient information. Our patient today, 79 years old female patient. Her chief complaint was, I have soreness in the lower right gingiva. And past dental history, implant placed at many implant placed on number 26, 36, 33, 34, 36, 37, 44, 46. The last of implant already installed, and the root canal treatment on number 16 area. And past medical history was the cancer surgery, so she currently taking medication. That is today's surgery's patient intraoral view, the pre-op situation. What about this lower anterior? The keratinized gingiva is almost gone away already, and just mucosa and the narrow ridge and resolved areas, the very poor condition. What is your choice? What is your plan about this sort of lower anterior narrow area? This one is pre-op panoramic view. One implant, the buried, the slipped on this number 33 area. It means teaching us the lots of history about this lower anterior, right? Okay, 43, 32, 33 areas bone, CT scan, cross-sectional view, narrowed ridge, and the alveolar bone was resolved already. And number 33 areas, the ailling implant was there. The buccal bone was gone away, so it is impossible to have I think this one is impossible to helping the superstructures after another new implant installation. Surgery plan is as follows. Removal of the existing implant fixture at number 33 due to buccal bone loss. Bone and soft tissue grafting using OSTEON Xeno as a bone graft, and collagen membrane hard type as a barrier membrane, and also applied collagen graft 1D for the open healing procedure. Implantation at number 43, a bright tissue level 3.011 millimeter, and another one will be installed on the 32 area, diameter 2.5 and 11 millimeter. About the tissue level, the bright implant system, as you know, a 20-degree external bevel system. This one is external connection. That is important first thing that you have to remind about this implant system. External connection, 20-degree external bevel. And platform is 3.8 millimeter. One single platform system, and the gingival height 1.5 polished surface with a concave. This one is for the soft tissue. The under controlled design means the soft tissue room for the healthy connection between hard bone and soft tissue. That is area. This area is very important and more important nowadays, as you know. Dome shape. And about bone graft. As a bone graft, OSTEON Xeno will be applied on this defected area. This OSTEON Xeno from the bovine cancellous bone, right? So what is the difference between the brand or the previous system, the bone grafting? Actually, OSTEON Xeno came from the bovine. However, the almost cancellous bone, that is more faster turnover. It means a softer and the faster turnover means a faster new bone formation, right? So easy to nesting the bone cells and stabilize easy stabilization of a bone cell and the vascularizations, the faster. And also, finally, we got the new bone formation, the faster than any other the xenograft material. The collagen membrane. The collagen membrane have two different types, as you know, the hard one and softer one. Today, the hard type collagen membrane will be applied. This hard type collagen membrane is conventional, the traditional type, the more resilience and stiff, a little bit the longer, long-lasting, the more than 6 months. That is an important characteristic if you want to use this barrier membrane for the GBR, the successful GBR procedure, as you know. So the collagen membrane hard type is enough to conserve these defected areas, bone grafted area. Okay, another one, the biomaterials will be introduced on this trade surgery, collagen graft. This one is nowadays the faster growing in our market. Actually, doctors, and especially in normal dentist, the general dentist, want to use this collagen graft. Cause of this collagen graft compensate open healing technique, and sometimes we're going to get some wound open situation after GBR procedures or some another complex procedures. But however, this collagen graft to compensate this open wound situation. So compared to the barrier membrane, this collagen graft is better, getting better to get the faster the epithelialization, faster soft tissue healing. Today, Dr. Chung may use this collagen graft combined with collagen membrane hard. We're gonna get the lessons and the tip of the procedure. How can I deal with this collagen graft? Big GBR procedure. Okay, let's move to today's surgery. The more detailed information will be given during the surgery video, right? Now, Dr. Chung make a crestal incision using number 12 scalpel, step by step. The crestal incision was made. The lower jaw portion, the crestal incision, is most popular. However, the upper jaw, the maxillary area, a little bit deviated the incision on the crestal area is popular. For example, on the maxillary posterior area, maybe 2 millimeter the deviated from the middle portion of the crest to palatally make a crestal incision. That is more comfortable to handle the flap manage. Why? The upper jaw, especially posterior maxillary area, the palatal flap, palatal soft tissue thickness is thicker than any other part of soft tissue zone, especially compared to buccal and the palatal area. As you know, the palatal soft tissues are thicker. So the almost 2 millimeter deviated to palatal, the palatally inclined, deviated the crestal incision. Actually, this para-crestal incision is more useful to manage the flap, the reflector flap, and then to make some osteotomy, and sometimes we're going to make the handle for the crestal approach for sinus elevation. All of these situations are able to have when you have the paracrestal incision on the maxilla. However, the lower jaw, mandible, the mid-crestal is the general crestal incision, the scheme. As you can see, the mid-crestal incision was made and the reflector flap and the lingual flap was reflected here. And about number 33 areas, the varied installed implant exposed, right? With the cover screw. As I mentioned before, for the lower anterior, these mandibular areas gave us a lot of history about the treatment and procedure. Why? They already installed these 33 areas. And another opposite side, the edentulous and the thin, the narrow ridge. When the patient came to our clinic, this patient was edentulous situation, edentulous manner on this lower anterior. Before then, actually she got already implant treatment, supported the bridge on these areas. I don't know exactly the reason, the how, due to some reason the failed implant was happened and removed already this number 43, maybe 42 area, and just remained this number 33 areas was installed implant fixtures still there, still remaining there. So on this sort of situation, if this remaining implant fixtures like number 33 is already installed here, these implant fixtures helping a new implant supported bridge. In this sort of case, you can use this fixture as a supported manner. However, not going to helping to make a new bridge. Removing this implant fixture, that is answer, right? So what about the labial surface? Actually, the 4-5 millimeter implant, the surface was exposed on the labial area. It means in concern of long term, that the follow-up for the long-term follow-up, I think this implant fixture is not helping anymore to supporting a new implant supported bridge. So remove this ailling implant is answer. Okay, now Dr. Chung used number 330 bar. 330 bar is very versatile. Actually, long shank 330 bar that make some indentation on the cortical bone plate like this one. Why this long shank 330 bar instead of Lindemann drill? High cortical bone plate area, even though the high speed of Lindemann drill, sometimes easy to slippery, right? So before using this Lindemann drill, the high-speed bar is very useful to make an indentation on the proper site, especially in the thick cortical plate area, right? So as you see, first, high-speed bar, the small indentation, and after that, they're using a Lindemann drill and take a position with the parallel pin. Wow, very nice. So parallel, like a machine. Dr. Chung is always make a good positioning like here. So I think due to the numerous experience about the implantation, implant surgery, so always, even though the freehand type, the manual type, osteotomy case, very similar to use the surgical stent style. However, in beginner or the general dentist, sometimes using the surgical guide is helpful to make a proper positioning on this narrow ridge. Wow, already installed this number 42 area, diameter 2.5. All the implant fixture surface surrounded by host bone. That is main key to using bright PR system, right? So all the implant surface surrounded by host bone. These implant fixtures are thinking down the host bone bed, right? Now, diameter 3.0. The excellent installation. The osteotomy procedure is so simple. Did you see the drill procedure? High-speed, small indentation, Lindemann 1, and final drill, and then installation. Just only 3 drill and implantation. Number 2.5 diameter case, actually 2 drill is enough to have osteotomy and installation. So already done, 2 implant fixtures installed on the very accurate, the precise installations accomplished on this plant site. Now, Dr. Chung is going to use 330 bar to make some trench around this the old installed implant fixture. The buccal plate was gone away, so make a small trench. And that is know-how. How can we deal with, how can I remove these failed or ailing implant fixtures already installed? So there are many different ways to remove implant fixture. However, this kind of procedures are simple, faster, that everybody have done like this one, when the implant fixtures should be removed, right? A small tip elevator located between implant fixture surface and make a trench area, and a little bit small luxation, like extraction of natural tools. And when we have some mobilities, using this small root forceps can be applied for removing implant fixture. Even though the little bit wide diameter and long body was installed on this very thick area, however, so fast to remove using this 330 bar, high-speed bar, long shank bar, that is very versatile and useful tool to removing the already done installed implant fixture. After that, remove plastic cap. This plastic cap, the working, the protection manner, right? The purpose of plastic cap is protection, the screw hole, the inside of the top portion of fixture. Removing plastic cap and connect with the scan comfort cap now. You see the sum of notch here, this notch for the scanning, right? This scan comfort cap, the working as a healing abutment, and the region is a scanning, like as a scanning jig. So sometimes this scan comfort cap using as a temporary abutment for temporary processes. Very versatile abutment. Now, the OSTEON Xeno was filled on this defect area. 33 big defect was filled with OSTEON Xeno, the bovine xenograft matures. Okay.
콜라겐 멤브레인 하드도
After filling with OSTEON Xeno, the particulated bone graft on this defect number 33 and 42 area. Okay, now that he's preparing the collagen membrane, the collagen membrane hard type. As I introduced you, this defect was a 3-wall defect, very comparable defect. The contained defect. This contained 3-wall defect is the good situation to make a new bone. So in this sort of case, the particulated bone with the collagen membrane as a barrier membrane is a good combination. Very nice combo. So another part also applied with collagen membrane. This contained defect is easy to get apply this the collagen membrane. Sometimes you can use pin fixation for the periosteal releasing incision and periosteal suturing. And however, sometimes just to put and the lab around this, the defected area is enough. The cause of the stiff buccal flap is holding the stiff buccal area of collagen bone, and the stability is enough getting for this stiff flap and the tugging between the flap and bone area. In case of a 3-wall defect, like a contained defect like this, right? However, if you want more, getting the stability on this area, so you're going to use the pin fixation, using the pin, or the periosteal suturing. Okay. After that, make a small hole using a punch and connect with a collagen graft with this skin comfort cap. Okay. Like engagement ring, this collagen graft was applied top portion of a comfort cap. Why use this collagen graft additionally on the upper side, the collagen membrane? Okay, now he's make a small periosteal releasing procedure using this periodontal curette. He is scoring the periosteum using this periosteal curette to make some the peristaltic releasing, right? So make some room after applying this bone grafting and the collagen graft for the more intimate closure during the suture. Okay, this additional collagen graft working as the faster the wound healing, right?
75좀 올려주고. 그렇죠. 옳지. 됐어요.
The vascular driven the epithelialization, that is correct term for the explaining using this collagen graft. The vascular driven the epithelialization will be achieved when we use this the collagen graft. This collagen graft, the holding the blood clot and some of the activating the cells to make a new bone, the bone cells and the plasma and the blood, and finally blood vessels engage this collagen graft, and finally make a faster the epithelialization. It means faster soft tissue wound healing, right? So this phenomenon I can explain as a vascular driven the epithelialization. So it means even if wound flap will be open, never mind anymore, cause of this collagen graft to protect this opened area, to promote the faster soft tissue healing. That is why they use this collagen graft, the top of the barrier membrane. This collagen membrane working as the barrier membrane to protect underneath graft materials until to make a new bone formation, until transforming new bone formation, right? So at this time, the flap exposure, some shrinkage during the healing period, the flap shrinkage, right? So the little bit the tangent, the suture during the suture, maybe tangent, not tangent freestyle, maybe a little bit the collapse and shrink, the collapse down to each another direction. The wound will be open, a little bit smaller, and then this collagen graft protect this open wound area. And that is why to use collagen graft on this area. Even though the primary closure, the intimate primary closure case, tangent will happen and the flap shrink during the healing period, as you know, right? And also this kind of areas, muscle tone, will be worked. So this the flap margin will be open. However, once more, this collagen graft working as a barrier. So this collagen graft promote the faster soft tissue healing based on vascular driven epithelialization. Okay, the surgery will almost done. And he need more interrupted suture. Before this, modified the horizontal matrix sutures was applied on this area, already done. Now interrupted sutures. Will be applied here. Can you see between two implant fixture the collagen graft exposure? However, the flap, even though the flap open, this collagen graft will be worked. So never mind about this open wound.
실밥 풀을 때 한 10일쯤 있다 실밥 좀 풀을까요? 네. 그러면서 그때 스캐닝해서 위치를 좀 작업을 합시다. 아니면 2주 있다 실밥 풀으면서 네.
So Dr. Chung is going to have a scanning for this patient after 2 weeks at the time point of stitch out, and make a scanning and take a file, and then make a temporary prosthetic procedures. Prosthesis will be applied for this patient. Okay. How simple the procedures it is. Actually, even though the 69 years old female patient, almost 80. So what do you think about? You want to make some big incision with horizontal and vertical incision, and then the full thickness prep and the periosteal releasing incision, and then make a big bone graft around these lower anterior areas with the implant fixation. If you choose like an internal connection type, maybe 3.3, even though the 2.8, maybe implant fixture thread will be exposed, and you need more effort, like a big bone graft and make some the space maintaining. For this purpose, make some sometimes screw engaging is a necessary part, and the big the collagen membrane should be covered, all of this GBR, the area. That's so complicated procedure. That is not good for the elder patient. However, today's surgery is simply done and very faster for the patient. And actually, this kind of procedures is suitable for the elder patient like this person with a simpler way, and helping a good implant system. The good implant system like a Bright TL, helping the implant surgery is simpler than before, and also doesn't need anymore the big periosteal releasing incision. The cause of open healing technique was available for using this collagen graft, brand new regeneration material. Okay, I think this nut is final. Good, very well done. All the procedures are simple, as you can see. Okay, very nice, and thank you for watching. We will have 5 minutes break, and then we will get the Q&A session. Thank you. Thank you for waiting. Now let's move to post-op view. The bright oral pack was applied after suture. This bright oral pack is self-released, self-resorbed the material. So very easy and useful. The protection, the surgery site, and the post-op panoramic view. The very nice parallel implant to implant fixtures was installed on 32 and 43 area. The diameter 2.5, 3.0 as you know. Okay, 33, 30, 43, 32 is a target area for the today's implant surgery. So what about 33? These areas removed all the implant, the ailling implant fixture, and then put the bone graft materials, OSTEON Xeno, the Xeno graft material, and covered with collagen membrane site, GBR site. These areas will be very nice newborn formation after maybe 4 or 5 months later. So after that, if you want adding more implant fixture, you can use this site, number 33, right? That is another option. In the younger person, that is necessary part one. Sometimes you need consideration, another one more implant fixture. However, the elder person like this, 78 years old, almost 80 years old female patient doesn't need any more. Just only 2 implant is enough to support 4 anterior bridge. Okay, now we have a question, a Q&A session here. I'm gonna have the questions. Very nice, a good question. Thank you. First, number 1, can the canine be used as a cantilever with a bright tissue level implant? Of course, yes. Normally, the canine area is very important, as you know, the canine guidance or the function group, the guidance with the occlusion scheme. On natural dentition, this canine is important corner tools, as you know. However, the implant system is totally different. Actually, these canine areas can be cantilevered, right? The implant mechanics a little bit different compared to natural dentition. So some case, this canine portion can be skipped, right? So finally, my answer is yes, I can. Okay, to make a canine as a cantilever, especially elder patient, as I mentioned before. These areas, if a complicated area, maybe it should be skipped, and the neighbor areas is enough to make 4 unit bridge implant supported 4 unit bridge. Let's see. Can you remember during the surgery procedure, Dr. Chung as first implantation on number 32 area before the removing the neighbor, the ailling implant fixture, right? Why? Because of this area is very important, like natural dentition's canine portion, right? So he don't want any bone loosening. Let's see, after removing the implant, the ailling implant, all implant fixtures, and then the bone grafting or the installating, make osteotomy. Let's think about this osteotomy. Maybe during the just only 2 drill, even though the two drilling, maybe this distal bone plate, the squeezing, the distally, cause of this area is void, right? So Dr. Chung doesn't want any more this area's bone loosening or the loosening the bone. He want to get the higher initial installation. This area is very important, right? So after inserting this bright TL, the implant fixture installation, this 32 area, and then removing the ailling implant, right? That is one of the reasons to make a procedure. Okay, number 2, what are the advantages of using collagen membrane hard during bone grafting procedure? Okay, a good question. Basically, when you have a GBR procedure, right, the main two sources, we need the main two sources. First one, bone graft materials. Another one, barrier membrane. As you know, the bone graft materials, there are many different types and different kinds in our market. However, four different the main sources. First one, autogenous, and the xenograft and allograft, alloplastic and allograft, right? Once again, autogenous, allograft, xenograft, alloplastic material, right? And about this membrane, the non-resorbable and resorbable membrane. Nowadays, actually, this resorbable collagen membrane is prevailed, as you know. This membrane have two different types. First one is have some the soft and resilient. Another one is stiff and hard. Both of collagen membrane have a different characteristic and different good point. However, this hard type is long-lasting. First one, long-lasting. So it is suitable for a bigger defect, like a big defect, 2 or even though the 1 or defect, we need more time, like more than 6 months, 7 months case. Actually, you should use this long-lasting hard type collagen membrane, right? So we need some long-lasting. Another one reason is space maintaining. This stiff membrane gave us a space maintaining. Some without another devices like a Dentium Korea or some devices. So self itself have space maintainable the characteristic. However, this one is softer and the resilient, and the collagen membrane, it is suitable for small defect. And also, you can use like a sausage or the same kind of technique. You use this resilient collagen membrane. However, generally speaking, this resorbable membrane, the soft resorbable membrane, is a faster resorption period, faster resorption time, maybe 2 and 3 months. So it is not enough to have a big defect bone grafting situation to make a GBR procedure for a long time, long lasting, for a long time successful the result, right? So that is why to use collagen membrane hard, Dr. Chung want to have perfect and good qualities bone, even though to contain the defect and familiar situation to make to transforming the new bone formation around this area. He want to make guaranteed these areas transforming new bone formation with high quality, right? In this sort of situation, condition, you have to choose, you have to decide to use collagen membrane hard type. Okay, that is my answer. Okay, thank you for watching today's surgery video, the monthly surgery video. Okay, next time we will have another surgery. The videos will be held on the August 21, the same time, 7 o'clock in Korean time. Thank you for watching again. See you next time. Bye.